Nurses do so much for the people in their care, but perhaps the most important thing they can provide is hope.
And for one Bay Area nurse, that means inspiring the smallest of patients by sharing her own story of beating the odds. News Channel 8's Jennifer Peñate joins us now with more.
Josh and Stacy, that nurse's name is Lindsay Arenas. Lindsay is entering her 17th year at Johns Hopkins All Children's Hospital on the same floor where Lindsay herself was once a patient. Here's why working there matters so much to her. Lindsay Arenas knows a good dose of laughter goes a long way for her little patients at Johns Hopkins All Children's.
They're having one of the hardest moments of their lives here.
How emotionally taxing is that?
It's hard, but it comes down to you're really lucky to do what you do and to make that difference in somebody's life.
Nursing, Lindsay says, is her calling.
I think I can bring a different ear and a different perspective and kind of maybe a calming attitude that we're going to get through this.
That's because she spent several years in one of these hospital beds.
I was pretty much living here in All Children's for almost those 2 years. I had probably about 20 surgeries.
When Lindsay was in kindergarten, she was diagnosed with the rare bone disease, multiple hereditary exostosis, or MHE. It produces abnormal bone growths all over the body. Her 3 brothers had it too.
Some people might shy away from coming back to the hospital where they spent so much time as a patient. Those memories, some of them might be a little hard.
Absolutely, yeah.
But to you, it means giving back.
Yeah, absolutely. And I can relate to the patient that has a chest tube, and I can relate to the patient that had spinal surgery, and I can tell you all of those things and those feelings.
Knowing the pain, she works to lessen it, an act of love that her patients appreciate. Some even come back to let her know.
She came back and she was saying how grateful she was and how she wanted to be a nurse just like me. And I was like, wow, that is so awesome. I was like that's really, really, that makes you feel really good.
A dose of optimism she too needs. Lindsay's 7-year-old son now occupies a bed here at All Children's, diagnosed with her same condition.
It can be easy sometimes and it can be hard because I can know as a nurse all these different angles that I need to watch for with him, and then to separate that to my role as a mom. So I definitely struggle a little bit with that balance, but it's nice to be reminded that my team has my back.
Does it feel like the universe kind of conspired to make sure that you had the second family here at All Children?
Absolutely. You know, sometimes life doesn't make sense in the moment, but years down the line, you can look back at that and say things make sense, right? I went through that for a reason. There was a plan with that, and now I can take those experiences and make other kids' experiences easier.
Wow, impressive lady.
Wow.
Very inspiring. You know, and what really stands out about Lindsay is not just her resiliency, but just the joy that she has. She loves her job, and she'll be the first to tell you that she'll be there for the next 40 years if she's able to. She loves what she does, and she loves inspiring those kids.
You know, just her laugh, you could tell it's so genuine that she just has found joy in life.
Contagious.
And bedside manner is so important, especially when you're in the patient side and just need some help and want somebody to listen to you.
As parents, you two know.
She's the type of lady that will.
She is.
That's cool.
Great story.
Thank you.
Thank you.